A lot of people are writing about 500, 600 rural hospitals are, close to closure. It's actually a whole lot more than that. That perspective of working in the ER changed who I was forever. Soon I decided that I wanted to have my own ER company because I wanted to be able to make an impact in the rural ERs across the country.
Michele Sexton has been an angel to many people in her life and career as a healthcare executive and entrepreneur that is focused on saving rural healthcare.
So we're here with Michele Sexton, and I'm Danny Moblin, the host of Humans of Healthcare. You've got a podcast that you've been doing a little bit of.
Yeah.
So what's that all about?
Mission Podcast. We just have a couple of folks that will join us and talk a little bit about healthcare, all kinds of things from recruiting to billing. And it's been pretty cool.
Yeah.
I never would have saw myself as being a podcast host, but lots of cool stories out there, just like you have in your podcast. So I definitely think that it's been interesting to meet people.
Yeah, and you guys have conversations, mostly about rural health?
Yeah, mostly about rural health. We still work with a couple of big systems, so there are things that translate into rural health, but also big system stuff as well.
Okay. So who are you? Like, how did you get into this? You were just telling me that you had this background that I didn't know about. We've known each other for about a year, so I want to set that up the right way. That I met you when I was at another corporation.
Yeah.
And then, we reconnected when I started, this entrepreneur journey that I'm on. And you've been there for me in so many ways. And it's hard to sort of express how I feel, but I'll start with an example. I was here in Nashville, which is where we are today.
Yeah.
And I was preparing to go in to talk to some company or investor, and you and your husband came by my hotel to see me, and you just helped me get myself ready, and this is the kind of person Michele is. She's a connector, and then she's going to stay with you and always keep tabs of how you're doing and then be there for you. Oddly enough, when you need her the most, she's there. And you and your husband just prayed over me, and it made my day. I went back into the podcast right after that.
I know.
That morning, right? And that was the best part of my day. No matter what happened, I was good.
Yeah.
Because you guys did that for me. So that's you to me. A great friend, even a motherly figure, if I might say.
Yeah.
It's I feel so comfortable when I'm around you. So, but I didn't know that you were a firefighter and an EMS worker. And you were just telling me a story, too, about how you even got into healthcare when you were in college, working at a clinic. So you want to kind of start there, you think?
Yeah, I didn't start out to be in healthcare. Ever since I was a small child, I had the dream of being in New York, working for an ad agency. I would be doing commercials when I was a kid, just writing commercials. And I wanted to have this fancy ad job and live in New York and all of those kinds of things. And I went off to college in Iowa, and about my second year in college, I was working at an after-hours clinic that would see college students, and I was working with a physician that he had only been a physician for a short while. And we'd see cuts and bruises and sore throats and those kinds of things. And a girl came, and she had had a procedure done and was very ill. We immediately called 911, but of course, when you do that, it takes a little bit of time for them to get there. And during that few moments, which seemed like hours, this girl who actually lived in the dorm room where I lived. And so it really shook me. I went back to my classes and was doing the whole business, advertising, public relations kind of thing. And I thought, this just doesn't mean what it meant before I had that encounter. And so switched my major to go into the clinical side of things. And did that for a while, started my career working in EMS, and also became a firefighter pay my way through college. I grew up in a pretty poor town and was the first child in my family to go to college, and so had to have a way of working sometimes 2 jobs to get through school, and really just was in my element working EMS, working fires, and just really loving that environment. And working the clinical kinds of things as I grew in my career, started working in the emergency room and really had a love for that, still have a love for that. Even as I've been a hospital CEO in past years, you'll still find me sometimes in scrubs, sometimes in the ER. They don't let me do all the things I used to be able to do. They might ask me for coffee or to answer the phone, but that perspective of working in the ER changed who I was forever. Like, it changed who I was as a hospital leader. It changed who I am as a business owner, and so went on to have a really nice career. Working with lots of big systems across the country, some rural, but some large systems, and went up the ranks as a hospital leader, and really loved that. In 2014, I decided to return to the ER in some capacity, and worked for a large ER company, and really loved that. But pretty soon I decided that I wanted to have my own ER company because I wanted to be able to make an impact in the rural ERs across the country. And I felt that even though I was working for a great company, I felt that there were so many contracts that we had that we really couldn't make a difference in the single ER in the middle of nowhere kind of thing. So out of that, Mission Physician Partners was born. And so we did that for many years, had a lot of success. And I really feel like we did a great job of working with hospitals and physicians and really bringing the two together. And that was really, for me, a big thing. Mission Physician Partners still exists, but we help small to medium-size ER groups work with hospitals and also run their businesses because they need to be able to do that as well. And so out of that came, once we were working in hospitals, folks would figure out that we had, my team had backgrounds as hospital CEOs, and so we would be asked to help hospitals with projects, strategic planning, hospital turnarounds. There's a time or two that I'll come in and be an interim CEO at a hospital myself, and so out of that, Mission Healthcare Partners was born, and that's where I actually met you because I was interim CEO at a hospital in Alabama, and that was part of your territory. So that's where we met. And so that's really kind of how this got started in October of last year, just out of necessity, really, not really having any really plans for this, but we started doing rural hospital management services for those hospitals that had a need for someone to help them. And so that's how we got started on that.
So the whole thing. So we're here in Nashville, which is kind of neat because this is the mecca, right, for hospital management companies. And so what you do is you'll go into rural mid-sized hospitals and you'll offer to come manage their hospital. You work with the board members of the community, and then how do you win a deal? How's that work?
So really, we start by listening. We start by looking at the hospital, listening to the board members. We rarely get a call from a hospital that is doing well. We usually get a call from a hospital where maybe the CEO has quit. They're in a financial bind. They are having trouble finding physicians, those kinds of things. And so we start by listening. Something cool we've been doing lately is something we call the hero assessment, which is like a 12-point assessment where we go in really quickly and find out, we look at a couple of things, recruiting and revenue cycle and compliance and some things like that, and figure out what's going on at this hospital that they're not having success. And then we start working with the board, working with the leadership team to figure out how can we fill those cracks? What can we bring to the table? And you and I were just talking about the fact that one of the things as Mission Healthcare Partners was born was that we had to really humble ourselves that even as seasoned leaders, and I have some folks on my team that have been rural hospital CEOs or hospital CEOs for over 30, 40 years. But we had to humble ourselves and say, you know what, the game has changed, and we need to bring folks into our team that are experts in various different fields. Because as a hospital CEO, there's just no way. You start your day out almost like in the ER, triaging what's the most important thing, for us. Is it staffing today? Is it, various different things that happen to you as a CEO leading your team? And so we basically started just collecting relationships that really can help our rural hospitals. For example, we have a relationship with a really awesome recruiting firm that can help hospitals place physicians. And traditionally, as a hospital CEO, we've said, we don't need to hire a firm to come help us place these physicians. We'll recruit them ourselves. But the game changed. It got harder. It got harder to recruit. And so by using this group that we use, Elite 365, to help us find physicians, we can really help a hospital that is in need. So that really kind of, is who we are, is really connectors and problem solvers. And so as we encounter a problem, and we still encounter problems that, okay, I've never seen that before,
Right.
kind of thing. We have a network of folks that we call trusted advisors that say, okay, here's how to handle this situation. And that's how we help hospitals.
Yeah, that's great. It's like when I think about the who, not how philosophy of doing business, right? I've said this before. I think entrepreneurship is very close to being a hospital CEO. I'm in a startup, and I have to ask myself every day when I come to work, am I going to react, or am I going to stay on task and accomplish the goals that I have? And the reaction draw, right? That is a powerful draw every day.
Yeah.
You can get really sucked into stuff. But I think the most important thing you hit on to me is the people that you put around you.
Yeah.
And the fact, I think, so we just built an app recently. So in the app, you have developers, and you can't just have one developer. It's really hard to hire just one.
Yeah.
There's so many different skill sets that are necessary to develop a good app, the whole 360, and nobody has that one skill set to do it all, right? And so I think about that, and I think about what you just said, and trying to help people relate to it is not one CEO can know all the stuff they need to know. Right. And so the who, not how philosophy is almost, if you don't have that mentality, it feels like you probably are not going to succeed, to a certain extent, because you're going to be not an expert in all these things that you have to focus on. Plus, you don't have the time. We've had people on our team and, on our leadership team for rural health leaders that have been worn down to the nub. That's and it hurts them from a mental health perspective. There's all the stuff that I've been seeing through you, frankly, about hospital executives that it's really challenging. Yeah. And they get in their own way sometimes, too. You want to talk a little bit about how their mentality, their approach can kind of be it could be detrimental to them?
Yeah, I told this story on my LinkedIn one time that I had coffee with a gentleman who was a top healthcare executive, one of the maybe top 10 CEOs in the country at one time. And we were having some coffee one day talking, and he was talking about, this CEO that he knew and that CEO. And so I said to him, about how many CEOs do you think that you have in your phone, in your Rolodex, if you can go back that far. And he thought about it for a second. He said, probably about 200. And I said, okay, out of that 200, write down 10 names on your napkin. And he did. And I said, out of those 10 hospitals, how many of those hospitals are actually failing, that, they're in real trouble? And he wrote down about 5 of them. And I said, out of that 5, if we called that hospital CEO up today and asked them if they needed help, how many of those CEOs would say yes? And he just kind of leaned back in his chair and he looked at me and he said, I don't think any of them would. And so I think we've ingrained in ourselves that if you're a hospital CEO, if you ask for help, it's a failure. And it's just not that way. And so that is a little bit why the hero assessment was born, is so that we could come in and take a look without really saying, well, you're doing this wrong or doing that wrong. It's a collaborative effort of, hey, we've seen this done this way. Hey, here, we've looked at your revenue cycle and we found out that some of this is being done in a way that, could be done differently. Those kinds of things. But yeah, it's there is a little bit of that, I think. Even in our performance evaluations that boards do of hospital CEOs, there are kind of unwritten penalties for bringing in outside folks, like bringing the use of consultants. I've seen performance evaluations from a board to a CEO where they'll talk about, well, you use this many outside consultants to come in. And while I agree that in some ways, just the circle of bringing in outside consultants and never doing anything about it is not where we need to be either. For me, it's really about, if I'm a CEO, how am I positioning my hospital by bringing in the folks that could help it?
Well, and so I think even the terminology used, for me, when you say consultants, I think money's going to go out the door.
Yeah.
But what you've done, is different. You've built a team of collaborators that are there for the right reasons, and you did it without having this pressure of having to build this conglomerate for yourself.
Right.
You weren't trying to get rich. You just said, hey, there's a problem. I know these 15 people or whatever, and they all have these different skill sets, and they're all good-hearted, and they're not going to charge the hospitals, a gazillion dollars. If it makes sense for them to make money and they can get paid, they will. But I can tell you, being a part of that team, I just want to help. And so you've connected people. So I think the way that the message is sent to the people that are out there is important, because it's not consultants. It's the who, not how. It's like we have who's that are friends that are willing to help us. And that's what it's going to take.
Yeah.
Is, people around you that are in the right frame of mind, that aren't, trying to make a ton of money off your hospital, because that does exist.
That does exist.
But you vetted that out. Mm-hmm. You have. And it's not, you weren't mean about it. You just found the right people and said, hey, is your heart right? Are you in this for the right reasons? And I can tell you, everybody at the table, because we talk every Friday.
Yeah, we talk every Friday.
And we start with, coming together and, we have a prayer and we take our time to talk about the things that we've all experienced in our daily lives. And and it's really a wonderful outlet for, I think a lot of talented people, frankly. Yeah. And so when you go into a hospital now, you got all these people behind you that you just, hey, Jody or, whoever it is, Danny, like, this is what I'm seeing. What do you think? And then you get advice and you get feedback, and they give you, because they want to help you, right? And I think it's a different thing than bringing a consultant in. To me, it's different. And
I learned from those folks. I learned from you. When I first started hearing about Downtime Trace, and I had been a hospital CEO at that point for over 20 years, and I knew at times, if our CT scan went down, the things we have to do, if our X-ray went down, what that looked like. I had no idea. Even being a CEO that long, I had no idea the ramifications, both, for patient care as well as financially for the hospital when that equipment is down. I learned that from you. And when I started to hear those numbers, it was staggering. When I started to hear you say, look, very often we'll come into a hospital and find they have multiple service contracts on the same piece of equipment that's costing $18,000 to $20,000 a year. I didn't know any of those things, but now that I know that, I collaborate with you and we talk that over for hospitals as to, let's take a look at all of those equipment contracts. Let's take a look at your downtime. Let's take a look at your equipment leases. Are they where they need to be? Is there a better way of doing that? I did want to go back and just talk for a second about, we have started to build this collaborative. And at times what that collaborative has meant is folks that were formerly our competitors coming together to the table. So recently we're bidding a contract to manage a hospital. And as we were going along, we really started to say, we know we're competing against these folks for this contract, but what's best for this hospital is if we work together, two competitors come together and really help save this hospital and help grow it, not only just survive but thrive. And so I had to have that humbling call of picking up the phone and calling the CEO of a former competitor of ours and saying, look, why don't we work together on this and bring what we collectively, you guys are really strong in these areas, we're really strong in these areas, let's collectively come together and help this hospital. And surprisingly, it was absolutely, let's do it, And so some folks probably didn't really care for that. There was some consultants, I think, that were involved in that said, this is unusual. We don't see folks, in the bid process join each other.
That's how you know you're doing it right.
Yeah.
I'm out there now shaking things up like crazy. And my gauge is when people come to me with, a little bit of vitriol in some cases because they don't want things to change.
Yeah.
But like you started off the conversation saying, it's hard for people to ask for help.
Yeah.
And I think one of the biggest aspects of that is like humility. If you think about a leader, this is why humility is important, right? So you can say, hey, I know we do different things. We might compete.
Yeah.
But we came together for the sake of the hospital. Now you're setting examples for other CEOs and other boards to say, look, it's not about the competition. It's about how do you help the communities.
Yeah.
And you have to be humble in order, I think, to do that. So I'm sure that informs who you look for when you look for a leader. If they have that humility, and I've met some of the people you put in place, and they do have humility, and then they are open to the help that they're going to need. Yeah. So I think you're setting an example by what you're doing.
It's I think for me, the thought of and it's kind of right now it's a buzzword, right? A lot of people are writing about 500, 600 rural hospitals are, close to closure. It's actually a whole lot more than that, because I've worked with quite a few, and I actually keep a list of rural hospitals, and I look at them year after year. How are they performing? And and I've been very worried about that. And I even talked to Scott Becker in a podcast recently, and he asked me kind of what my one fear is. And I said, the hospitals that have traditionally done okay, they've traditionally broke even, that's not going to be a reality in the future. And so those hospitals are going to also get close to failure. And that really is scary to me, because not only do I see these hospitals just from an outside view, I see them as a mother who had a child when my daughter was around 3 years old, and she had asthma and had an asthma attack. And that 3 minutes it took to get to the local hospital, if that would have been 20 minutes, I'm not sure how that would have turned out, right? Yep. So also working in the ER and understanding that folks that are coming into these rural hospitals sometimes are very sick. And if they had to travel, even by ambulance, to, a town 20 miles away, a town over the mountain, a town, like that, it would not be a good outcome. And so I think that gives me a little bit of a different perspective, because for me, it's how do we keep these hospitals viable? How do we keep these ERs open? I think, again, that background in ER kind of dictates everything that I do. When I come into a hospital, it's one of the first things we look at. And, part of the hero assessment, one of the first places that we look is how are we doing in our ER? Because that will dictate how everything is happening in that hospital. And so, and particularly the community's perception of care at that right, hospital. Exactly. And so this is an area where, I'm pretty tough. Like, when I come into that ER, I expect that, that the staff is friendly, the facilities are clean, that we're caring for anyone regardless of their ability to pay, and that we're basically giving the best care that we can give with the best physicians, with the best team, and so that's that really for me is important.
This episode is brought to you by Downtime Trace.
In the world of medical imaging equipment, downtime is costly. Finding the right service options and determining if they are available shouldn't drain energy from medical professionals. Every day, healthcare workers face unique anxieties. It may seem small to some, but not knowing which local service experts are available, their qualifications if they're competent, when they are available is an unnecessary energy robber. With Downtime Trace, you can easily book local service technicians and get real-time notifications on your phone, similar to those you're accustomed to from mobile apps in your personal life. Once on site, service technicians capture a video of the problem they observe, diagnose the service needed, and provide a clear service plan with an estimated labor and parts costs and completion time. Familiar technology matched with decades of experience. Track parts and service progress and get the right updates when it makes the most sense. Once the service is completed, view comprehensive service data and rate their performance. Technicians gain greater autonomy by choosing independent jobs, while Downtime Trace ensures they receive payments within days compared to the many months that typical payment terms take. Downtime Trace ensures seamless communication, better and faster compensation for independent technicians, and complete transparency in service management. Download Downtime Trace now and take control of your medical equipment service.
Yeah, well, I remember you telling a story about you going and physically sitting in the ERs.
Yeah.
And you look around and you go at the hours of the night and parts of the day that are probably most challenging for that ER.
Yeah.
Right? And you observe, and it's like you jump into EMS or firefighter mode, right? And once in a while, when you see something you don't like, you'll actually take action right at that moment. But you can't probably get a feel for it if you're not physically there watching how things go. But the interesting thing about the way you told that story is you talked about the admissions person that was behind the glass or whatever, and their behaviors and their attitude, which was a big deal. You talked about the patient's perspective, right? And when you get to tell a story like that, it does bring it home, because I've been in those ERs and I'm always wondering, how do they know what this experience is like? Well, because you go and you can see with your experience how it should be, and then right away
you remember every story.
Oh, yeah, let me so. I mean, because that's the people's stories are everything to me, And the way that you've been able to draw me into your world is through these vivid, depictions of what you've experienced, right? And so in the hero assessment, it's not just me. I mean, I'm a medical equipment guy or whatever. But you have coding and billing. You have locums, which I've never heard about before. I didn't know what that was. And then you have a number of other, like, staffing and other procedural things that, most people might not think about, when it comes to, hey, I need help in these places. But if you bring those experts in, what you do, they find it. They find something, and it seems to always improve whatever situation. And it's not expensive. I mean, it's not going to break the hospital. It's going to be financially viable for them, right? That's really it has to be because we couldn't operate otherwise. But I think about that. And then I also think about the people that you're going to put in place at that hospital. They're going to be like you. They're going to be, you're liked by you. They're going to like you. You're going to like them. It's like, there's a lot to be said about the positivity and the way that you could communicate these things. Whenever you tell a story, I don't think, man, that sucks. I think, wow, that's interesting. And that's a positive way to look at it. I'm glad she took it and did something with it. Yeah, it kind of sucks what they were going through, but I'm glad to hear that you turned it around into a positive.
I use that story actually a lot. So when I work with hospital CEOs and I say, if there's nothing else you do this week, go spend 15, 20 minutes in your hospital ER waiting room and see what you see. And that particular story was I was starting to work with that hospital on a Tuesday morning, but on that Monday night in the middle of the night, I came and was sitting in the ER and watching what was happening. And incognito, probably they're wondering what in the world is this lady doing sitting in our ER? But I was watching it, and this hospital had really been struggling for years and had lost a lot of its market share, had lost a lot of good folks, team members, physicians. And I just was sitting in that ER and noticed an older gentleman who had come in and it was very busy and he wanted to register and the clerk, probably with good intentions, but also being overworked and kind of, undertrained probably, had said, it's going to be a really long wait. Why don't you just come back in the morning? And listening to that and hearing that and seeing him and seeing what his complaint was, there's certain trigger words, that in the ER. And I said, wait a minute, like this gentleman's really sick and he needs to be taken back right away. And so I came up to the desk and talked with a gal. She had no idea who I was, but I said, I really want to talk to the physician about this gentleman. And sure enough, he was having a heart attack. So had he went home, that night, I'm not sure what would have happened to him. But we talk a little bit about that as there are times where even as a CEO during the day, I will go down into the ER and work at the desk and just get a chance to see what's going on. And that's a little bit of advice. The second part I think I wanted to talk a little bit about was having a good mentor. Yeah. That's so important. Yeah. And as hospital CEOs, I think we've lost that kind of art. There's a lost art of mentoring for these younger CEOs coming out of getting their MBA and becoming a hospital CEO. And so that's important to us as well at Mission is that we connect those folks and really talk with them and listen to them. What are they going through? What do they have to add to the table as well? And I look back to my mentors, which, were back in the day, Quint Studer. Just an amazing gentleman who changed my life. He changed my life because I gotten into working in the hospital, in hospital administration. And I just was like, this is just so far from what I thought it would be. And then I worked with a hospital that had implemented the Studer program. And I thought, I love this. I love this. And ended up, being my team, a couple of Firestarter awards later, that kind of thing. There's also a gentleman named Brian Paradis who completely changed my life as I was, later in my, career, talking with him. And he wrote a book called Lead with Imagination. And all of the CEOs that work with me, I say, you got to read this book. And then he also, started writing a book called Lead with Love, which at that point in my career, as through the years, we've lost that art of loving each other. We've lost that art of loving our employees and loving our colleagues and loving our physicians and those kinds of things. And so I had this opportunity to share this story with him that I was interim CEO at a hospital in Georgia. And I was just loving on these employees and really hearing what their needs were and this kind of thing. And a few of them came to me and said, you've changed our lives in your short time of being here as an interim. You've changed our lives. And as I got in the car, and maybe I cried a little bit, I called Brian up and I said, look, here's the cool story, is because of your teaching for me of lead with love, I've now been able to pass that on to these young leaders, and they've told me that mattered. There's hospitals I work with, leaders I work with that I've worked with 10 years ago, and I'll come back, and still keep up with their lives and just listen to them and hear what's going on, because I think that's important.
This is you. I mean, you live this, and I think that's why we're going to make a difference, is because, right, you got to introduce love. I also believe in the humility and the who, not how, to go back to that stuff. Right. But if you start with infusing confidence and love into the people who are leading, that's right. And they'll kind of sneeze on everybody else with that same sort of mentality. Yeah. They'll love other people. So you have an outlet now to get it, I don't know, you can, it's your mission, right? And then you go out and you convert others into loving another person. But I love the results. I love when people show you and they share with you what it meant to them. And I'm sure the guy who wrote the book, Brian, right? Yeah. That you made that call. And like, that's a Studer thing, right? Yeah. You follow up and tell people what they did that was kind for you. And then you spread it through the kind stories. And you're doing a lot of that. Like I know it's common, it's common for you. It's just part of who you are. But I never would have done it until I read these books. These books are important. I do the same thing with my team. Yeah. Mine right now is the E-Myth, because I do believe that hospital executives, if they did take on more of an entrepreneurship type business mentality, but it's systematic stuff, like how did McDonald's bring in teenagers to work, in a restaurant? And, so how do the policies become easy enough for people to follow? And can you make all that stuff clear about, and so like, that's part of what I do on my side. I think there's some business philosophies that we can, infuse into some of these things. But as long as the mentality is number one, I think love and caring and humility, but then also, what are you trying to get to? Like, if you make it exciting where you're going, people will buy in. Yeah. If you have passion and it's a clear vision, people will follow you all day long. And I think our leaders in the hospitals, whether you're CEO or CFO, or COO, right? Like, they all need somebody to pour into them. Yeah. Right? The love, the knowledge and all that stuff. And that's where I started. Like, my journey started in this healthcare market industry with CEOs poured into me, rural CEOs, by the way, who changed the course of my life. Yeah. And I don't know why they did. Pretty cool. They were awesome. And they were in Eastern Oklahoma, this unassuming territory in the United States that nobody's ever going to go to or know about. I feel like now, because of them, my whole goal in life is to pay it forward, right? And so all of this, what we're doing here, is because of them. Because they said to me at one point, they're like, when you get to a place where you can, pay it forward. Yeah. Because that's all they could offer at that time. Yeah. They didn't have the money. They didn't have the business for me. It's just like, they showed me the way. And so this is how we do it. Like, we pay it forward. This is what we're here to do. It's our calling.
I love, and we have a colleague, Doug Morse, that I had him on the Mission podcast not too long ago. He really goes into hospitals, and he basically shows everyone in like the manager, the director of radiology, the manager of the lab, what are we aiming for? What are our goals? And so, he starts with the leadership team, but then he basically goes across the organization. Does everyone understand what our goals are for this year? And it was just such simple stuff. Like, he has a spreadsheet that he has the managers putting out, and even it goes to the employees as well. Do you understand what our goals are for this year as a hospital? Do you understand what we're trying to do? And just that training of going in and working with the staff of understanding. Do you understand how our budgets work? Do you understand if we're over budget, what that means to the organization? And so, just meeting some fascinating folks like that, going back to the Mission podcast, just being able to meet some folks like that and hear those fascinating stories and see them in action that's just been really cool.
Yeah, and he's got a special way of delivering a message.
Yeah,
he is the
absolutely. He's a teacher.
He's
a teacher.
I mean, I met him a couple of times. We talked outside of our group, and I just feel like he cares about me.
Yeah,
right out the gate,
absolutely.
He cares about me, and he's there for me. And no matter what we talk about, he's going to be focused on helping me.
Yeah,
right? And that's the kind of people I think we're surrounding ourselves with.
Yeah,
and I think for any hospital out there, there's no barrier to entry to get into what we're talking about.
Right.
Just come. I mean, just join.
Yeah.
You're going to have people who turn to you and pour into you. And I promise at the end of one meeting on our Friday meeting, you'll walk away feeling like you're feeling better.
Yeah.
Just and a little bit more hope is what you'll probably feel.
Yeah.
So just join. That's as simple as it is. And we don't have any prescription for this.
Right.
We'll find a way if we need to or not. You can just come, have people that are like-minded that really kind of, I'd say we love each other, and you get support, you get kindness, and the rest of your day is great, going into the weekend.
That was the intent for the Rural Leaders Call, is basically that folks could just come together, and sometimes we talk technical stuff. A couple of weeks ago we talked, the position changes coming for reimbursement. We talked some technical stuff like that. But then there's also days that we in the recent weeks we've talked about what do you do when you feel like the odds are against you? Yeah. When you go to your hospital board meetings and it feels like you've gone to war, kind of thing. And then, I think it's just really the special perspective everyone has. I think at first people were a little bit like, well, what's going to go on here, kind of thing. But I love that. And I wish more folks would join the Friday Leaders Call, because I feel like they could get something out of it. And then even one gentleman that was on, or that joins our call, I knew he was kind of going through a hard time. And so I sent him a card a couple of weeks ago. And when he got on the call, he said, you know what? I was having a really hard day yesterday, and I got this card in the mail, and it just was a card of encouragement. And so that was pretty cool.
Do that for me on. It's just you'll see a podcast that I'll put out, and you'll tell by the tone. You're paying close attention to me. You know me well enough. You can tell if my voice is off, or if I seem a little bit off. And sometimes the content will give it away, but mostly you're seeing me, but you're paying attention. And I think that's what I love about this, is that when you come onto our calls and you become part of our group, people pay attention to you. They care about you, and they genuinely want to do whatever they can. Yeah. And we're trying to teach each other how to help each other, but you're actually setting the example for us on sometimes it's just as simple as you being thoughtful and considerate about what that person's going through. So with that, everybody, please join it. Yeah. It's a Friday morning call. Anybody's welcome. And, this is Michele. What you just saw is her to me, and then some. She's going to go above and beyond for you as a human being. And, I don't know, you just make me feel better about what I'm doing.
Don't you make me cry. Hey, I'm so proud of you. I'm so proud of, it's been a cool place to be on this journey with you. From, hey, Michele, I have this idea, to we're going to make this idea happen. And I know what I love is that on your LinkedIn, and you share the stories of an entrepreneurial CEO, it's not all highs. There are lows. There are days that's like, what am I doing? Could I just get a regular 9 to 5 and, that kind of thing. And I love that, because I think you are influencing folks that are thinking of starting their own business, or are already starting their own business, and they are, sometimes they just get discouraged. And I know that anyone that watches your podcast, if they reached out to you, no matter what you were doing, you would take a moment to say, hey, friend, call me. Let's chat. Let me tell you how I feel about this. And And so I'm just blessed to be on your journey and watching what you're doing, and the zest you have for this field of saying we can do this different. And it's disruptive. This is absolutely disruptive. There's downtime trace. There's nothing like it. And so for me, even as a CEO, again, it was a little hard to, can he do that? Can he, right. What are the barriers to him being successful? And at the end of the day, I was like, he has an idea that is amazing, and it's going to change lives. A lot of folks that, I think we've forgotten the human aspect to certain things, like even equipment. Yep. Okay. So even equipment, if that CAT scan is down and a patient comes in that we need to have that CAT scan to make a critical judgment of how we're going to care for that patient. Yeah. And not even thinking about the revenue that's lost or any of that. That patient, there's been some high profile, and you and I have talked about it, high profile folks that have passed away because certain things weren't available to them. And so I think of that now when I think of the CAT scan being down, is if someone shows up on our doorstep and we're unable to use that machine to diagnose and quickly treat them, that's going to be harmful to the patient, and so what you're doing is really going to save lives. And I think we forget that as leaders, that that the decisions we make, the physicians we collaborate with, the team that we train, these are the folks that are going to save lives. We worked with a hospital in the Midwest, and one of the things that we do when we come into the ER is we train for situations, we train for surge, we train for disasters. That's important to us because everything is, when you look at an ER and it's a normal day and everything's going pretty smoothly as it can in the ER, it's easy to train for those scenarios, right? What's harder to train for is when everything that is in the manual of how this ER should run just gets thrown out the door. And so we trained for surge, and we said everyone in this hospital has a piece to this surge. So if we call, this surge level or a second surge level, environmental services, administration, cafeteria, this is your responsibility. So we train for that, for the time that everything is maybe going wrong. And about 3 weeks after doing that training, they had multiple policemen in their community were shot, and a couple died. And they were able to take the training that they used in that, in those scenarios. And I know people were thinking this scenario is never going to happen, this kind of thing. And use that to say, okay, here's how we're going to take care of all of these gunshot victims, at once. And what's that going to look like if I'm dietary? What's my role? Right. And right. Okay, I've got to get some food down, to the staff, to the providers, to the families that are coming in, that kind of thing. And so that was like that was a terrible situation. I would not have wished on any hospital, but I was proud that this hospital, how they handled it and how prepared they were.
Yeah, they're strategically positioned to do what they do best.
Yeah.
It's fun to watch people when you give them a little bit of, love and trust, and they take ownership.
Yeah.
And they do it at the most critical times. I just watched a World War II movie, and all the people who went into action to save their country, and it brings the
incredible
together, right? I mean, there's all these reasons to, but even as you're planning, you're getting closer and you're having to think through these scenarios. So I got to run, but thank you for this.
No,
I've been wanting to do this for a long time. You're an amazing person, and
I'm so proud to be your friend.
Thank you very much.
Hey, this is your host, Danny Mobley. Thanks for watching Humans of Healthcare. Please subscribe below for more great interviews.